This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health. Hey beautiful soul, it's Jacqueline here from the Labia Chronicles, where I discuss all things lichen sclerosus. So if you have lichen sclerosus and are looking to empower yourself with information, acceptance, and want to reclaim your life, then definitely subscribe to this channel and keep on watching. And if you have a loved one or friend, family member with lichen sclerosus, and you want to learn more about the disease, the physical and mental health aspects of the disease, so that you can better support them in their journey, then please share this channel with them and definitely keep on watching. So in today's video, I am going to be addressing platelet rich plasma as an option for lichen sclerosus. As always, any medical sources, journals, articles that I consulted in the making of this video will be dropped in the description box below. So feel free to check those out if you want to take a deeper dive into the science behind it. And if you find the information in this video helpful, please give me a like and leave me a comment. So before I start, I just want to add a little quick disclaimer, caveat. So the information in this video is information that I've received from reading through different medical journals. I have personally never had platelet-rich plasma, or what I'm going to call PRP. I've never had it, so I can't speak from lived experience. Now, my philosophy with this channel is, at the end of the day, my goal is really to present what I learned from the medical literature to help you make informed decisions about your health and your treatment plan. But that said, there's more to a treatment plan than just what the research says. It's also important that you feel safe and comfortable with your research, with your treatment, I should say, and that the treatment plan you decide to pursue, that aligns with your values. So I talk about this more in my ebook. So if you're interested in learning on how to pick a treatment plan that is good and safe and right for you, then definitely go download my free ebook, which you can get at lostlabia.com/ebook. And as always, I will have that linked in the description box. Okay, so let's start with the question, what is platelet-rich plasma? So I'm basically just going to be calling platelet-rich plasma PRP moving forward. So to understand PRP, we have to start at the basic level, which is our blood. So our blood is composed of liquids and solids. The liquid component is called plasma, and that includes water, salt, and proteins. On the other hand, we have the solid component, which includes red and white blood cells, as well as platelets. Now, platelets contain growth factors, which are super important for healing. So PRP is basically plasma with a higher concentration of those platelets, i.e. it has a higher concentration of growth factors. So PRP essentially helps to promote healing by stimulating that release of growth factors as well as cytokines. Now, cytokines are essentially just proteins that, when released, they signal to the body to do its job. So let's say I have a shoulder injury. If there's a release of cytokines, the job is to heal the shoulder, to calm the inflammation and get the shoulder to heal so that I am no longer in pain and can function normally, right? So we got function of the shoulder, I'm able to move it around. So that's essentially a really quick Coles Notes version behind it. Now, PRP has been known to be helpful with a number of health conditions, including but not limited to venous ulcers, there's Achilles tendonitis, muscle and ligament strains, a ton of different types of injuries and conditions. It has been proven to be effective in treating them. So in order to prepare PRP, here's kind of like the process. Essentially, it starts by the clinician will draw a blood sample. Now, once they have that blood sample, they're going to separate the platelets from the red and white blood cells. So we just have those platelets. they're then going to increase the concentration of those platelets via a process called centrifugation. Centrifugation? Not sure on that one. I'll like put a little text so that you can see the word that I'm trying to say. So once that process is done, what's left, that high concentration of platelets, that is then injected into the injured area. So in the previous example of a shoulder injury, they would inject it here. In the case of lichen sclerosus, it would be directly injected into the vulvar tissue or the tissue wherever your lichen sclerosus is. So when did PRP kind of come onto the scene as a treatment option for lichen sclerosus? So as I mentioned, PRP has been proven to be effective in treating a number of health conditions and injuries. And because of this, many started to wonder about the possibility of using PRP to treat lichen sclerosus. Now, the logic behind that thought goes something like, if it is the case that PRP can help heal and regenerate damaged tissue, then perhaps if PRP was injected into the site of lichen sclerosus skin, it would have a similar regenerative effect. Therefore, we start seeing in about 2010 onward an increase in studies looking at or assessing PRP as a treatment option for lichen sclerosus. So what does the medical literature say about PRP and lichen sclerosus? So there are like a handful of case reports on PRP and lichen sclerosus. Now, a case report is essentially just a very detailed report on one individual patient. So it will have like their medical history, their symptoms, which treatments they tried, how they reacted to treatments, etc. So in the case of PRP and lichen sclerosus, Franick et al. Did publish a case report in 2018. The issue with this report is it's hard to really, confirm something with one patient. You kind of want a bigger patient pool to see whether something is truly effective, I should say. And then the other issue is that the study wasn't blinded, so there's a lot of possibility for bias to creep in. And for those of you who are unfamiliar with the term blinded, if a study is blinded, it means that, so you can have you can have multiple types of blinded, but a single blinded study means that the patient doesn't know which treatment they are receiving. A double blinded study means that both patient and clinician do not know which treatment the patient is receiving. So they could be getting a placebo or they could be getting the real drug, but neither participant would know. And therefore this kind of reduces the likelihood of bias creeping in and affecting the end results. So that's really important. We really want to look for strong quality studies when we're looking through the literature. We want to look for studies that are controlled and blinded and have strong evaluative measures, which I will go into evaluative measures in a bit. So it's hard to really gain much understanding of whether PRP is truly effective or not from looking at these case reports. So let's look at some more substantial studies that had a larger participant pool than just one individual patient. In 2010, Casabona et al. Published a study assessing the efficiency of PRP along with adipose-derived mesenchymal cells in 15 people with biopsy-proven vulvar lichen sclerosus. In this study, all 15 patients actually reported complete resolution of their symptoms. So this is awesome. On first glance, this looks extremely promising for PRP as a contender for treating lichen sclerosus. However, there are some methodological issues in this paper that make the initial conclusion not so certain anymore. So let's go through those. So the first issue is the fact that the authors used two treatments at the same time. So patients weren't just being injected with PRP, they were also being injected with adipose-derived mesenchymal cells. So they were actually two injections, two different treatments injected into the same area. This means it's not really clear which one is responsible for the success. So it's not sure if it's the PRP alone, if it's the mesenchymal cells, or if it is a combination of the two. So in this respect, it's not to say that it's not effective. It's just that we need more research. We need more studies that will look at just, the adipose-derived mesenchymal cells in isolation, and then the PRP in isolation. And then we'd want another study with a combination of the two. We would want those studies, of course, to be blinded and controlled to eliminate bias coming from any direction. So that's the first issue that makes it, well, we don't really know, like, was it the PRP, or really did you need the addition of those mesenchymal cells to have the effect that the patients reported? The second issue is that this paper had a lack of evaluative measures. So an evaluative measure is just kind of an objective measure of how are we going to determine whether the treatment is successful or not. Now, this could be done in a bunch of different ways. For example, the clinicians could use a questionnaire. They could use an agreed upon scoring system. They could use pre and post biopsies as a measure to see whether something was successful. But unfortunately, the authors of this paper, they don't really talk about their methodologies or their protocols, other than they do talk about how the PRP and how the adipose-derived mesenchymal cells were kind of extracted. Like the preparation, they talk about the preparation and they talk about the injection, but nothing else. There's no mention of evaluative measures. There's no mention of anything like that. I would suspect, given the way that the authors worded it, that the evaluative measure here was just a kind of questionnaire asking the patients, like, initially, what are your symptoms? And then a questionnaire post-treatment being like, okay, now what are your symptoms? And then they would say 000 or something like that. But because we don't really know, it's still kind of unclear. So to me, there's still a big question mark here on whether and to what extent PRP is a good, strong contender for treating lichen sclerosus. In 2020, Tedesco et al. Published a study which had a lot more participants, which is awesome. So their study had 43 male and 51 female participants. Their study noted a significant decrease in symptoms in both male and female patients after 6 months of PRP treatments. Both female and male patients said that they noted a decrease in pain as well as burning. However, the female patients said that painful sex was still prominent. So the 6 months of PRP did not help with painful sex as a symptom for the female patients. And while the authors did note that 62% of their patients reported an increase of symptoms, again, there are some methodological issues with this paper that make it really hard to know whether the conclusions they draw are really strong conclusions. So it's kind of still inconclusive. So their study did not include any strong objective evaluative measures, so no pre and post biopsies to see if the levels of inflammation actually reduced. No, controlled scoring system or anything like that. So again, kind of unclear is where I would put this one. Not to say it doesn't work, just that we need better studies with stronger methodologies to ensure that the conclusions we are drawing are accurate. So that is the Tedesco et al. Paper. And then we have one more paper by Dr. Goldstein that I will go into next. And this is a 2019 paper, Dr. Goldstein et al. Now, they wanted a study that had strong methodologies in place. So because lichen sclerosus is a pre-malignant condition with very high levels of inflammation, they wanted to use pre and post biopsies as an objective measure to see does PRP actually treat and reduce the levels of inflammation in the tissue, or does it not? Because that's really important. If you've watched any of my previous videos, does lichen sclerosus thicken the skin, and what is lichen sclerosus and is it serious? If you haven't seen those, I'll pop those in the corner. You can check those out. I'll also add them in the description box below. But lichen sclerosus is the single most inflammatory skin disease that you can have. We are talking very, very high levels of inflammation. So in order to really control the disease, we have to reduce the levels of inflammation. How do we test that? Well, we can see on a biopsy the inflammatory markers, and we can see those. And then if we have one at the beginning when you're diagnosed, they'll have very high levels of inflammation. And then if a treatment is successful, then after that treatment is done and you get another biopsy, there should be a statistically significant improvement, i.e. reduction, in that inflammation. So let's take a look at that Goldstein et al. Paper. In 2019, Goldstein et al. Conducted a double-blind, controlled, randomized study that looked at 30 patients with biopsy-proven vulvar lichen sclerosus. Now, of those 30 patients, 20 were given the PRP treatment and 10 were given the placebo effect. Now, this study was double-blinded, as I mentioned, in that neither the patient nor the administrator knew which treatment was being given. Then that is because they essentially, if you remember that little vial image that I showed at the beginning, the syringe that you would put the platelet rich plasma into, those were completely blackened out. So you couldn't tell what was in it. And it's important that these studies do this, that they are blinded, because bias can come in and affect the data and therefore the results and the conclusions we draw from those results. That bias can come not only from the patient, but also from the administrator. So this is really, really crucial to have a very strong study. Okay, so what did the results show? So they had two evaluative measures in place. So one was pre and post biopsies, and they're looking for, in order to be considered a success, in order for PRP to be a successful treatment for lichen sclerosus, the authors needed to see a statistically increased a statistical improvement in the levels of inflammation after treatment. And then the second evaluative measure they had was that they had a scoring system. And both the scoring system and the pre and post biopsies concluded that PRP is not an effective monotherapy for treating lichen sclerosus. What is a monotherapy? A monotherapy just means it's the only treatment being used. So, you know, in the first series that I did on treatments with clobetasol, for instance, so that's a topical corticosteroid. In that case, so that's how I treat, and I use clobetasol as a monotherapy. If I was not, I might use my steroids with PRP. So their study is strictly looking at only PRP as a treatment. And from that perspective, the authors concluded that it is not effective as a treatment for lichen sclerosus. But it could be a helpful add-on for people that are having certain symptoms that won't resolve. So that's the Goldstein et al. Paper, and that's the majority of where we stand with respect to the medical literature on the question of whether PRP is an effective treatment for lichen sclerosus. Okay, so final thoughts. Also, I apologize. The sun is now setting and it's like creating a funny thing on the screen, but I digress. Okay, final thoughts. So at this juncture, I think that really we need still a lot more research on PRP. We need studies with larger participant pools, and we also need studies, with stronger methodologies so that we can really feel confident in the conclusions that are being drawn from these papers. And the majority of them don't really elicit a lot of confidence other than the Goldstein et al. Paper. Which just leaves a lot to be asked, a lot of question marks that need to be filled in. So definitely more research needs to be had. Now, while PRP at this moment of recording, which is, I never remember the date when I'm recording. February something, 2022, at this juncture, it seems that PRP does not have a statistically significant improvement on inflammation levels for lichen sclerosus, and that is therefore perhaps not the best option as a monotherapy for treating vulvar lichen sclerosus. But instead, it might be good as an add-on, so perhaps steroids and PRP. But again, we'd want more research there too, right? We'd want to maybe have a study that looks and compares a control group that is just on steroids and then another group that does steroids and PRP to kind of see, does it make a big difference? Does it make no difference? Anything like that. So again, yep, more studies, it. Okay, I also just want to emphasize in closing that inflammation, it's really important to reduce inflammation. This is important for treating LS, for reducing the likelihood of developing vulvar cancer, for slowing down the progression of the disease. But your lived experience of symptoms and your quality of life matter too. Those are just as important. And our quality of life can suffer quite significantly, right? So this matters. So if you're able to afford PRP and you haven't had success with some of the gold standard treatments such as topical corticosteroids or calcineurin inhibitors, then this might be a good option for you to look into. Another case could be, let's say you're using steroids and you have seen improvement. You've been using them for a really long time and it seems to get you like 80% better, but it just doesn't take you the full way. Then again, perhaps you might consider exploring PRP as an add-on therapy to see if we can get that extra 20% so that you can feel awesome. But again, I present these studies so that you can, take them and kind of make informed decisions about your health, whether that means doing PRP completely or having PRP as a kind of add-on therapy. That's up to you. I'm just kind of here to give the information, to report what I see, what I find in the literature. So I want to close this video by thanking you so much for watching my videos, for supporting me in my content. I so appreciate you. And of course, as always, if you have questions, please leave them in the description box below. I love hearing your questions and answering your questions. Also, if you've had PRP, please share your experience in the description box below, because this video is basically me just reporting on what I've read in the literature, but I haven't had PRP, so I can't speak from a lived experience perspective. And I would love to have more lived experience brought into this discussion. So if you've had it, please let me know what your experience was like in the description box below. Not the description box, my gosh, the comment box. And yeah, that is it for this one. I will catch you in the next one.